Doctor, why don't you kind of walk us through what happens during an asthma attack? And we actually have a biodigital image that you can kind of help show us what is going on.
Absolutely. So as we look at the graphic, you'll see that this is kind of what happens when everything is great. So the muscles of the breathing tubes, the bronchi, are open, and there's not a lot of secretions. The airways are nice and open. Everything is nice and relaxed. So add to that any sort of trigger. You catch a cold, cold air, perfume, your teacher's perfume, and all of a sudden everything starts to change. So you get the trigger for smooth muscle in the airways to kind of start to constrict. You're getting your bronchospasm. You get the inflammatory mediators from the inflammation that's part of asthma to start to produce more mucus, more secretion. So now you've got a smaller airway because it's smaller in diameter, plus you have stuff clogging it up, right? You have mucus clogging it. And then on top of that, you have maybe ongoing exposure. So now the child's already coughing and now they're starting to feel even more anxious, which can also be a trigger to continue to kind of make things get worse and cascade on. So some of these will be hints as to the different ways we attack the asthma and trying to attack the different things that are causing that airway to kind of close up.
Okay, and Doctor, you just kind of walked us through what happens there, talking about airwaves getting tightened up, if you will, that feeling of breathing through a straw like I referred to. And I'm just curious, do more boys than girls experience asthma, or how does that compare?
You know, there's some disparity because we'll see that before puberty, it's more common to see asthma in boys and girls, but then it's also more common in adulthood to see more women than men. And there's no real sound reason that they've been able to find as to why that happens, but we do know that asthma is multiple different things playing a role, so we may not be able to find that one link that tells us why boys earlier in life have it before puberty than girls, but we know that we can look at the different factors that can play a role in producing asthma and individualize that plan.